Welcome back to the new TikTok account of the National Association of Medical Examiners. A comment came up, or a question came up in the comments section on one of our prior videos about ascertaining time of death. And this is a huge topic, and you need to purge everything television and Hollywood has tried to show you on any of this, because that's all nonsense. It's nothing like that. Now, using postmortem change like rigor mortis and livor mortis or liver mortis, these things are useful and can be used particularly in the early postmortem interval and if a lot of factors are known. What type of environment were they in, and was that environment stable? What was their activity and baseline health prior to death? These all influence the rate at which those changes like rigor mortis set in, stabilize, and then pass. And so those are all things that are occurring over a matter of hours, and so they are useful. However, rather than using taphonemonic methods like that, it's actually been pretty well established that more basic concepts are actually more accurate. So when did they last check off on their calendar that they took their morning meds versus their afternoon meds? We'll see that all the time. They've got their meds all laid out, and they check it on their calendar, and they never miss for months at a time, day after day, and then all of a sudden stops. You have just narrowed down when they were last alive. Other basic human activities, logging onto their social media accounts, sending a text message. Back when people received paper newspapers, getting their newspaper off their porch, getting the mail out of their mailbox. Finding those dates and those times of normal everyday human interaction is as accurate or more so than trying to use sophisticated calculations and chemical analyses of vitreous humor, electrolytes, and things of that nature. So those do have a place. Rarely do we need recourse to them, and we can usually actually pin it down as accurate as we're ever going to be with much more basic concepts.